Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Well, this past July, Tracy, the American Red Cross issued an emergency call for blood and platelet donations. Now, summer can be an especially quiet time in the local blood bank because a lot of people are out of town, they're on vacation, they're not around to give blood. And, of course, there are a lot of people out doing things that end up having them go to the emergency room. They're riding their motorcycles or their four-wheelers or water skiing or whatever. And, of course, there's the problem of the Zika virus, which has affected donations as well. And I just read where the FDA has now recommended that all blood donations in the United States be tested for the Zika virus, a new problem.
In addition, the typical blood donor is usually of older average age. So there's a real need to cultivate new blood donors from younger generations.
Yeah, no, the millennials should know that they can actually use their smartphone while they're giving a unit of blood.
Very good.
It's not a big problem.
Can you hunt Pokemon? That's important. Here to discuss the importance of blood donation is Medical Director of the Blood Donor Center at Mayo Clinic in Rochester, Dr. Justin Kreuter. Welcome back to the program, Dr. Kreuter. It's good to see you again.
Thanks for having me.
So how big of an impact has the Zika virus had?
It certainly uses a lot of bandwidth that we have for collecting blood. There's a lot of regulations that we have to pay attention to. We certainly want to have, and we live out our culture of having a safest possible blood supply in this country.
So are you now testing for Zika virus in the blood that you get?
Right now, we don't have access to that test, but in the coming weeks, we will be testing. So within the next 12 weeks here in Minnesota, we'll be testing all units that we are collecting.
Are patients concerned about the Zika virus?
Certainly, patients ask about it, and right now we are protecting our blood supply by asking all of our donors about travel history and deferring donors that are taking those summer vacations down south of the border into Zika risk areas.
So is it true you oftentimes come up a little short in the summer as opposed to the winter?
Absolutely. Yeah. In the summertime, when our donors are out and about, taking trips, when they're traveling, they're obviously not available to come in and donate blood. And then sometimes those travel plans also get in the way of being eligible as a donor.
And what makes someone eligible or ineligible?
Well, it's all about safety for the patient. So that's why we ask about where somebody is traveling to. For example, we don't have a test for malaria. So we want to know if somebody is traveling to a malaria risk area. And if they do, we defer them for a period of time to make sure that their blood is safe when transfused to a patient. The same thing with Zika right now. We're protecting patients by asking where our donors are traveling to. And that will change once we start testing our blood.
All right, and tell us about some of the other criteria that you use for who can and can't be a blood donor, because Tracy mentioned before the program that she couldn't be a blood donor.
I'm a lymphoma survivor. Hooray, but I want to give blood too.
Sure. Well, it's interesting. So for some things, it's regulated by the FDA. So certain medications that a donor may be taking may make them ineligible for donating blood, or it may just be them ineligible for donating a certain component of blood for a period of time. For example, if somebody is taking aspirin, we ask that they not donate platelets for 3 days after taking that aspirin.
Because aspirin interferes with platelet function?
Correct. And so if somebody is donating a dose of platelets that's going to be used for a patient, we want to make sure that not only that the blood product that we're transfusing to patients are safe, but they're also going to be clinically effective.
And who else is not eligible? Who else who comes in and says, I want to donate a unit? You say, well, you can't because?
Well, in some cases, it's interesting. Cancer history in donors is variable across our country. So the FDA doesn't regulate donors, donate cancer for deferrals for donating blood. That's on an individual decision based on the medical director of the donor center. So here at Mayo Clinic, people that have blood cancers such as lymphomas, leukemias are permanently deferred from donating. However, we have different policies for other cancers. And so really, I guess for the listeners is to check with your local blood center to see what their policies are for your particular situation.
You are permanently deferred.
I know. I'm on the list.
But you know what? You're alive.
I am. You know, we were talking about encouraging younger people to become a blood donor. How old do you have to be be to donate blood?
So it depends on your area. So here in Minnesota, people that are 16 can donate blood with parents' permission, but everywhere across the country, 17 and over are eligible to donate blood.
Do you pay donors?
We don't. So that's something that is very closely monitored, because it's, again, another layer of safety that we want to make sure that somebody coming in and donating the time and their blood is not incentivized in any way, so that we're making sure that their answers to these questions that we're asking, some of them very personal, very private questions, that we're getting honest responses. And that's, again, one of these layers of safety for the blood supply.
And what are the other things that people can donate besides blood? Aren't there, like, I don't know, there's people who do just the quick donation and then they're there in the chair for 3 or 4 hours. What's going on?
So most commonly, people are donating whole blood when they come in and donate, which takes the actual donation itself takes maybe about 10 minutes. But sometimes people come and donate platelets, and that does tend to take about an hour or two of actual collection time to do that donation. So these are these different components of our blood. So there's red cells that somebody can donate specifically. Somebody can donate specifically the platelet component of what's circulating in their bloodstream.
Well, why wouldn't
or
you just give
plasma.
them the whole thing and let you kind of divide it up the way you need to?
That's an excellent question. So it has to go with what our patients need this day and age. So, for example, if you were to donate a whole blood unit, there's a small amount of platelets distributed amongst that unit. And actually what we transfuse to a patient is usually 5 or 6 times what's just there in that whole blood unit. So in years past, we used to collect those platelets and pool them together in pools of 5 or 6 to transfuse to a patient. Whereas now most people across the country are collecting platelets specifically from one donor to a patient as a platelet unit. So it's a way to get a higher amount of product for a patient.
And what I just wanted to know, how long what's the shelf life here? When you get blood from a donor, how long can it hang around?
So it actually depends on the blood component, or in fact also on how we collect that blood, what kind of preservative that we use. In this country, we're really hand to mouth with regard to platelets. That has a 5-day shelf life. And those first 2 days are taken up with doing infectious disease testing. So we really only have about 3 days to use that product. And as you were talking, that there's still patients that come into our emergency rooms with traumas, and there's a lot of variable use for this product that we're very hand to mouth on. So we're very dependent on our blood donors. So platelets is only 5 days. Red blood cells, whole blood, is typically around 42 days, and plasma units we can keep frozen for about a year.
So it's a volunteer program, and we certainly want people out there to volunteer and give blood. So a couple of questions. Does it hurt? And how long do they need to plan on spending in your lab?
So as far as hurt, it's just like getting a blood draw. So it's a needle in the arm, and we certainly have professionals who are doing this all day to try to minimize that pain. As one of our donors eloquently said, the amount of pain that it takes from getting that little needle stick is nothing compared to what's going on in our patients.
Well, it's great to have you with us. Dr. Justin Kreiter is Medical Director of the Blood Donor Center at Mayo Clinic, Rochester. Here's letting everybody know we need blood.
Absolutely. Thank you, Tom.
Yep, thanks for being with us.